Methylsulfonylmethane, or MSM, is commonly used for reducing pain and swelling in the joints caused by osteoarthritis. Some herbal and dietary supplement products containing MSM may have harmful impurities or additives, so it's important to check with your pharmacist for more information about the specific brand you're using. It's also worth noting that the FDA has not reviewed MSM for safety or effectiveness, so it's advisable to consult with your doctor or pharmacist for more details. As for the benefits, MSM is known to support joint health and function, and it's typically taken in dosages ranging from 500 mg to 3,000 mg per day. It's best to take MSM with a meal to improve absorption, and some people find it helpful to split their dosage up throughout the day. Always follow the recommended dosage on the product label, and consult with your healthcare provider for personalized advice. When taking MSM, it is important to follow the directions on the product package and take it by mouth as directed. If you have any concerns or questions, it's best to consult with your doctor or pharmacist for advice. If your condition does not improve or worsens, or if you suspect a serious medical issue, seek medical help immediately. Some possible side effects of using MSM include upset stomach, headache, or worsening of allergy symptoms. If any of these effects persist or worsen, it's important to seek medical advice. While very serious allergic reactions to MSM are rare, it's crucial to get immediate medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. Always consult with your healthcare provider before taking any medication. Before starting to take methylsulfonylmethane, it's important to let your doctor or pharmacist know if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more information. If you are considering a liquid form of methylsulfonylmethane, keep in mind that it may contain sugar and/or alcohol. If you have diabetes, alcohol dependence, or liver disease, it's important to use caution and discuss the use of this product with your doctor or pharmacist. For pregnant individuals, methylsulfonylmethane should only be used if it is clearly needed. It's important to discuss the potential risks and benefits with your doctor before using this medication. If you are breastfeeding, it is unclear whether this medication passes into breast milk, so it's best to consult your doctor before taking methylsulfonylmethane. When taking MSM, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs as well as herbal products. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much MSM and experiences severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the US, residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Make sure to keep all your scheduled medical appointments and any lab appointments as well. This will ensure that you are getting the most out of your treatment with MSM. It is important to stay on top of your healthcare routine and follow up with your healthcare provider as recommended. If you forget to take a dose of MSM, you can take it as soon as you remember. However, if it's almost time for your next dose, it's better to just skip the missed dose and take the next one at your regular scheduled time. Avoid taking a double dose to make up for the missed one. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications and herbal products away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. When the product expires or is no longer needed, be sure to properly dispose of it. Consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.